So in this section, we're going to be covering nutrition recommendations and goals throughout each developmental stage, beginning here with infancy through adulthood. And it was really fantastic that Dr. Pulfus added in the research article at the beginning of the talk that helps highlight the nutrition and work group put together. And a lot of these guidelines will be covered throughout this segment to refer back to as well. So this emphasis again is on healthy eating and nutrition for a general healthy lifestyle. Again, this not necessarily looking at it from a total appearance state for weight management, but it's essential to kind of start here in infancy to see how things change and progress and how we develop those habits early on and then throughout as we get into adulthood. To begin, the American Academy of Pediatrics recommends exclusive breastfeeding for at least the first 6 months of life. And we know this can certainly be challenging for any infant, but even those with spina bifida. And this might be related to multiple factors. So maybe there's interruptions for surgeries or medical procedures. Maybe we're having the infant learn to suck, swallow, and breathe. And so managing all that can be challenging as we're trying to progress with growth early on. So infant formulas can certainly be added at this time. And then a lot of times we might even have to consider what is happening with the growth and if we need to add higher caloric concentrations and different levels of calorie delivery if that's necessary to achieve desired growth. As the child ages, we're going to definitely be thinking then about adding solid foods. And the complementary solid foods is necessary to meet increased iron and possibly more protein needs depending on the amounts of breast milk or infant formula that are included in the diet. But also solid foods are necessary for practice with eating from a spoon. And this is important not only for nutrition and getting in a few of those essential minerals, but also for developmental skills. So often this transition can cause constipation. So we definitely like to make sure that the patients are talking about this with their care providers if that is a prolonged issue. Monitoring growth at this stage is definitely going to occur and necessary to be monitored regularly at regular intervals, typically weekly at first and then monthly and more often if necessary. The goal here, of course, is adequate weight gain, but proportionality, though, too, for what the child's length is key. So some infants might be at risk then for growth failure potentially, or be determined to be failure to thrive, based on the CDC or WHO growth charts that are being looked at. So this can often cause great concern for families, and sometimes it can lay a foundation for prolonged concern with eating and growing that might persist through subsequent developmental stages. And this can occur even when we have catch-up growth occurring. And when we say that we're achieving adequate growth, getting those infants to more like the 50th percentile for height for weight or positive BMI Z-scores. So taking all that into consideration as we're looking through this stage. Adding in some textures here, of course, might be challenging too in that first year of life. And so as the care team, we're paying attention to what foods are being accepted, especially if Chiari malformation is present. That may add an additional layer of feeding challenges. So it's important to be discussing these progressions with food with your care team to determine if more advanced feeding therapy would be necessary or helpful. So oral motor skills are being developed along with adequate attainment of energy and protein needs for growth. On the next slide, the infant then transitions into toddlerhood. So it's important to have a division of responsibility, we say, and we quote Ellen Satter principles here when we talk about the division of the parents having the decision of what and when to offer these foods, and then allowing the child to decide what they will eat and then how much. So here, offering foods from all food groups is key. And then that will help create a less stressful eating environment and set a more positive tone around meal times. So with that in mind, it's important to have a goal of offering a variety of foods and then allowing the child to accept the foods, not just by eating them, but taking them in through all their senses. So allowing them to just tolerate seeing the foods, smelling the foods, and hopefully eventually tasting and then eating the foods to help then expand the diet and diet choices. We recommend setting a schedule for eating. So the goal would be to offer 3 meals and 2 snacks about every 2.5 to 3 hours. And this will allow the toddler to cue into hunger and avoid the grazing. This can be done with, again, the 3 set meals, at least 2 snacks, maybe 3 snacks, depending on how the day is. At those eating occasions, it's important to be intentional then about offering a grain food, a protein source, and then a fruit or vegetable. It's also important then to have that fortified beverage there. Usually it's a whole cow's milk with that calcium and vitamin D source. One food can be a food that is normally accepted, but sometimes it's important to then offer new foods so you can help the child expand the diet and add more foods accepted in their repertoire of foods that will be consumed. Encouraging parents to also eat with the child, model those healthy behaviors is really a key piece for toddlers to learn, then to be able to trust the foods that are in front of them, and then have confidence in eating as well to expand on those tastes and textures. We know food jags typically occur and they're normal. Sometimes, though, they could be a signal that growth might be slowing down at certain periods. So it's important then to still monitor growth, of course, and then go through these reports with care team. And then to note that if it's prolonged, we want to make sure that there's still adequate intake occurring, because this stage is so important for brain development that we want to make sure that we have adequate intake there as well. And then, of course, maintaining that adequate calcium and vitamin D through that milk or milk fortified beverage that's present in the diet to help with the bone development at this time. And if those foods are limited or omitted, it's really important to have assistance with determining how you're going to go about getting those minerals and vitamins in the diet in an alternative way. On the next slide, we talk about nutrition for the school-age child. So at this juncture, we're seeing a lot of changes nutrition-wise. Here we tend to see a little bit more slower growth, but yet we have a bump up in what the vitamin mineral needs are. So sometimes that can be tricky to get in and get that balance in. And so here is a good time to start discussing with your care team and having the care team implement strategies to have weight management plans in place preventatively, just as part of a normal healthy lifestyle, to not then think about it later, but again, kind of thinking about ways to do that. So choose your beverages wisely. The goal, of course, is to get in enough fluid, and later on in a few slides, we'll talk about what that means and how to calculate what that actual fluid amount might look like. It's always important to limit juice. A study just recently was published this past month looking at consumption of juice and how that directly relates to overweightness and obesity potential. So getting in juice can be sometimes of a different treat or alternative there, but keeping that in a smaller amount is key to help keep the over-calorie consumption there more limited. Sometimes that juice amount can make someone feel thirstier, so we tend to overconsume that. So again, limits there on the juice. We really want the fruits and vegetables in the diet to help provide fiber, and that can definitely be void in juices. Getting in adequate vitamins and minerals, as we've already highlighted, is really key at this stage too, since there's a little bit more of a bump. And so definitely, if there are any foods or food groups that are being omitted, it's important to get those minerals from an alternative source. So knowing what that option might be for you or for the child is definitely important. Keeping those fiber-friendly foods in the diet and having that exposure early on is a really helpful way to go about combating constipation. So a variety of fruits and vegetables, and we'll have some other slides that kind of highlight how to incorporate fruits and vegetables to make them really half of your servings, half of your plate, essentially, every time we have meals and snacks is really something else to think about. The majority of our population do not meet the recommended fruit and vegetable goals. So really still emphasizing different ways to get that in the diet in different forms, whether it's cooked, whether it's, even some versions of small cut up grapes, maybe in a frozen form or some alternative there is important to keep trialing to see what might be accepted. And then, of course, adding in whole grains, nuts, seeds, and legumes for alternatives for fiber as well. On the next slide, we go through nutrition for adolescents. So here, lots of changes are happening in the adolescent world with some growth spurts, but typically we're seeing lower energy expenditures. So with lower energy expenditures, as we saw in the previous talk, learning then to keep that balance there of what energy is coming in, knowing here at this point in this stage, we have a little bit more of a lower energy expenditure, but knowing that we still need adequate nutrients present with that moderation. So the emphasis there is to continue to focus on foods to keep in the diet. Get these foods first. Our fruits, vegetable servings, whole grains, adequate protein sources, and we'll talk a little bit more about what that might look like. Getting in, again, the adequate vitamins and minerals. So getting that variety there in the diet is necessary to achieve those goals. And the emphasis on foods to, again, incorporate in the diet is important for a healthy relationship with eating. And then getting involved in food preparation. As we'll see very soon, that eating responsibility will shift. So having that adolescent involved with preparation, whether it's even making a grocery list, taking those shopping trips, having a garden, learning more about food. There's a variety of ways to expose one to food and food in the diet for eating and health. And that might help get somebody then to that transfer of responsibility for eating. As we move into the next slide, and for nutrition for the teens and young adults, there's a noticeable shift on that responsibility of eating. Here is when there's a lot more of choice being made by the teen or the young adult. And the goal again here is still to make a couple of key choices, especially when it's related to smart snacking. We want to make sure that there's still that variety there, but we want to know that all foods can still fit, and there's ways to still snack and have those other foods, but maybe learning how to pair them with adequate protein sources is helpful at this point. So for example, if we want to have chips, is there a way then we can pair it with a protein source, maybe like a hummus, that gives you then a little bit more variety of fiber, protein, and that feeling of fullness when you're having that meal versus just loading up in one food group, for example. Getting an adequate protein is essential for many reasons, but learning what those food sources are, so whether it's coming from a meat source, a vegetable source, from the legumes or the bean group, is really a helpful tool. And then how much protein? So we'll go through that a little bit more specifically, but taking your weight in pounds and roughly around half of that amount, or knowing what your weight in kilos is and slightly less than that number, is about the amount of adequate protein one would need in a day. And then from there, breaking that down into 3 meals is helpful to spread out the protein. So you're getting a balance at each eating occasion with then a little bit left for snacking. That helps give you a more balanced approach to eating, helps sustain your blood sugar levels, and then give you a better feeling of fullness. The same there with adding in those fruits and vegetables to help round out the diet, again, for the vitamins and minerals that are essential, but as well as the fiber. Finally, having in those milk beverage sources is necessary to achieve adequate calcium and vitamin D, and then the non-calorie water or other non-calorie beverages to help fulfill the fluid requirements there is necessary as well, as we'll talk about in a couple more slides. We'll move on then to the adult nutrition, and having a plan for lifelong health is at the crux of what message that we're trying to send today. You can visit myplate.gov for specific guidelines, and then you can actually go in and get the right plan for you. You can enter in your specific data related to your height, your weight, and your activity level to identify what amounts of these food groups you need. And that will help give you a starting point. And I would encourage you then to look at that at each meal and perhaps measuring out and equating to what those cup suggestions might be, for example, for your fruits or vegetables, would be helpful to learn and get an idea of the portion sizes. As we talked about earlier, we have a little bit more of a distortion of portion sizes in society in some aspects. And so getting an idea of what actually a half a cup or a cup looks like will help with that planning as well. And then finally, revisit what those goals are. You might have to take a little bit of time to record what that intake is for a period to see if there's something that maybe has changed in the diet over time. These are just some helpful tools that you can refer back to help you as you move along. On the next slide, we just highlight a couple of key principles here in looking at bowel management moving forward. Really, it's making sure that we have enough hydration in our systems, as well as that balance of the soluble and insoluble fibers. So wanting to know exactly how much fluid is necessary is key there, and looking at it from the approximation of what your body weight might be, and then a calculation of adding an extra fluid as we go along. And some of those principles are really well highlighted in that first article that everyone has received. But for example, if you're a 40 to 50 kilogram weighted person, roughly 8 to 9 cups of fluid is what would be required. Getting in adequate soluble fiber from foods such as beans, and then a balance there with insoluble fibers from foods such as whole grains helps give that water and bulk and soft stool build that helps more with bowel movements. And the recommendations of fiber are listed there based on age. So roughly 25 to 30 plus grams are needed there. So that would be on average of 7 to 10 grams of fiber per meal. So taking a moment to again look at those food labels and see about how much you're getting at a meal might help give you more of an idea if you're meeting those guidelines and goals. Moving on to the next slide, we'll look at wound healing and muscle maintenance. So we've talked a little bit more about the extra needs for protein at times. We want to prevent any type of wounds or openings, and that might require a bump up in some of these nutrients, such as the protein that we've discussed. And that is our calculations that we look at based on body weight, as well as looking at it from getting in enough calories with that balance there with activity. But definitely something to think about here from a practitioner standpoint. Can kind of walk through these calculations with those that have questions about that, as well as adding in sufficient amounts of micronutrients and omega-3 fatty acids there with diet changes there as well in consideration. So for example, making sure that there's a strong presence of fruits and vegetables, and then omega-3 fatty acid foods, considering additions of salmon, fatty foods, and walnuts in particular. Finally, I just wanted to leave with a few more references on the next slide to consider. And these are some tips, so some recipes that we can add for young ones, as well as suggesting that you talk to your care team to discuss more about nutrition with a registered dietitian, and then resources here if that care needs to be found. Thank you so much for your time. We will now turn it over to Dr. Kreitzler, who will be discussing physical activity.